Hi, I'm Dr. Paul Kuo, and I'm a hepatologist at Stanford University. And I would like to take a few minutes to discuss with you the importance of having patients adhere to treatments for their chronic hepatitis B. Now, chronic hepatitis B is an important public health issue in the United States and worldwide. Worldwide still is the most common and driving force for liver cancer. And unfortunately, in the United States, there is a large pool of patients who have yet to be diagnosed. And even in those who are diagnosed, we need to do better in initiating therapy when indicated, because treatment for hepatitis B with our currently approved therapies improves clinical outcomes. So let's talk a little bit about this. So when you see a patient with hepatitis B, of course, you need to appropriately assess what type of hepatitis B they have. That is, are they an inactive carrier? Do they have active infection with active hepatitis? And we have excellent treatment guidance documents that help us to determine who needs to be appropriately treated. The World Health Organization also recently updated their treatment guidance and have lower thresholds for treatment. Moreover, there will be very soon an updated AASLD treatment guidance as well. And if you determine that your patient is appropriate for therapy, you have to have and establish an appropriate relationship, particularly with hepatitis B, where the majority of people in the United States are actually foreign-born. You do have more suspicion of Western medicines in many of these populations. Moreover, many of these people who come to us are quite dismayed at their diagnosis. They may not have been aware of their parents had hepatitis B, and many of these individuals can be young, and they find out that they have this chronic transmissible disease. And when you're in your second or third decade of life, this can be quite dismaying. And it's important that we make sure these individuals understand, number one, that this is a disease that is treatable, number one, and number two, the medicines that we use, if appropriate, are highly effective and will allow, if you will, a return to normal life activities, and most importantly, markedly, if not completely, zero risk of transmission to other individuals. And just something that we are striving for with hepatitis B is that if you're undetected, you can't really transmit the virus. This is something that is documented in HIV individuals. And again, in hepatitis B, we have emerging data that the same strategy applies. So how do we address these? So again, when working with your patients, the important things to make sure they understand is that this is a disease that they will need to manage the rest of their life. They typically either acquired the disease when they were very young, many in their native country, or they acquired this disease through vertical transmission from their mother during or around birth. And these individuals are at no fault for acquiring their hepatitis B. Their immune system was quite immature at infancy, and there are very, very high rates of chronicity because of this. So when discussing therapy, you can actually help bring peace of mind. That is, that when you take therapy effectively, you effectively suppress the virus. The risk of transmission already is low because in the United States, we have hepatitis B vaccination, and all individuals who are born at this point should be appropriately vaccinated for hepatitis B. But if you have a patient has a partner, they're educated about the vaccination guidance so that anyone in the household can check if required to make sure that they're appropriately vaccinated. And of course, there are costs as well. Now, we have multiple approved therapies. There are three primary approved therapies: tenofovir disoproxil, there's tenofovir alafenamide, as well as entecavir. And all three are pills that you take once daily. If you have commercial insurance, there are copay systems available for individuals to acquire and mitigate the cost. And tenofovir disoproxil and entecavir actually can be available as low-cost generics. Often, if you go to sites that have coupons, one example is GoodRx, you can actually acquire these medicines inexpensively, so that there really are minimal financial barriers for most people who have chronic hepatitis B, and that's quite reassuring. Also, because it's just one tablet a day, then particularly for most individuals, taking one tablet a day is not a huge burden, but obviously, if this is a new diagnosis, you can set up reminders. There are lots of different smartphone apps, which most of our younger patients have smartphones and can remind themselves to take the medicine on a regular basis. You do have to follow these individuals on a regular basis, but one of the things that I emphasize is that treatment that with hepatitis B actually reduces outcomes. And again, these younger individuals or older individuals oftentimes are dismayed to find out they're potentially at risk for hepatocellular cancer, for fibrosis of the liver, for cirrhosis. And one of the things that these classes of medicines have shown us is that you really do improve fibrosis if you have this over the long period of time. And not only that, you also reduce the risk of hepatocellular cancer. Moreover, if you do have a patient who presents with rather advanced liver disease, cirrhosis, you can actually reduce rates of decompensation or even recompensate with hepatitis B because this is an inflammatory disease. And again, this is something that we try to emphasize to our patients simply because many of these individuals go seek out other alternative therapies. So they may seek out, for instance, some traditional herbal medicines or supplements. And we try to emphasize that these alternative complementary medicines do not have the same track record of hard outcomes. And it's important, while we certainly acknowledge we're not trying to interfere with how they conduct their life, there is no evidence that these other alternative therapies actually improve outcomes, whereas our first-line nucleoside analog therapies that we're discussing really have been shown to improve hard outcomes, and there are robust data sets which demonstrate this. It's also important that you establish that you're going to need to see these individuals on a regular basis. Usually with chronic hepatitis B, when I first meet them, particularly if I'm trying to decide whether or not to treat them, you might see them once every 3 months for the first year, just to get a sense of how the AST and ALT are fluctuating, how are their HBV DNA levels fluctuating, and whether or not these individuals need therapy. Once that's done, I tell them twice per year is an appropriate follow-up interval. And I try to make an analogy with chronic hepatitis B, just as someone might have high blood pressure, just as somebody might have diabetes. These are individuals who are going to need some type of regular care, but with regular care, their long-term prognosis is good. And I stress that they can have kids. For those of female sex, I emphasize that with appropriate care, you can mitigate completely the risk of vertical transmission to their children. And they find this quite reassuring as well. And I tell them they're really, with this diagnosis, there are no limitations on what they can do in life. And instead, by undertaking regular visits, they're much more likely to not have liver-related complications as they get older. And so this is really a partnership. Other aspects that are helpful here is to make sure that other family members get appropriately screened. And again, for hepatitis B, we certainly need more awareness of this disease. There's a large pool of individuals out there who don't know they have this disease, many of whom, again, are younger. And it's important that we reach these individuals, link them to appropriate care, and in those who do require treatment, these individuals should be reassured that the treatment is going to improve their long-term outcomes. Moreover, even if you don't need treatment, hepatitis B is a chronic disease, we still need to follow these individuals because this is a dynamic disease. You may not need to be treated now, but you may subsequently require treatment. And again, it's important to check in twice per year with these individuals. And in the future, where we have therapies that may achieve functional cure, this means clear surface antigen. It is hopeful that in a few years, hepatitis B can be treated as successfully as some of our other successes, such as viral hepatitis C. And over time, and it will take time, that we can reduce the burden of complications of hepatitis B, not only in the US, but worldwide. Thanks so much.